The Board of Commissioners declares that the board will uphold the constitutional right to peaceably assemble and will take necessary action within the limits of the Constitution of the United States and of North Carolina to prevent looting, destruction of property, and other acts of violence that are unlawful, unacceptable, and contrary to the purpose of peaceful protest. Furthermore, the Harnett County Board of Commissioners implores the President of the United States Congress, the North Carolina Legislature, the Governor of North Carolina, and law enforcement agencies to protect the rights of all law-abiding citizens to peaceably assemble and to prevent or subdue any attempts to loot, destroy property, or commit any other violent acts which threaten the safety and well-being of all citizens and their property. Signed by the 5 Harnett County Commissioners. Do we need to?
Need to vote on it.
We'll need to take a vote on the...
Commissioner Sprinkle, I make a motion that we approve the resolution.
I'll second that.
We have a second. Is there any discussion? Commissioner McCoy?
Yes.
Commissioner Johnson?
Yes.
Commissioner Sprinkle?
Yes.
Commissioner Miller?
Yes.
Commissioner Penny votes yes. It's unanimous. It's a 5-0 to adopt this resolution for Harnett County. Thank you. Next on our agenda, we have a public hearing on proposed resolution of the Harnett County Board of Commissioners to relocate boundary lines between adjoining fire protection service districts. We will now open the public hearing.
Do you want to open the public hearing?
Excuse me, we'll hear what you've got to say, then I'll open up the public hearing.
Thank you. And I've brought this to you before. This is regarding the district lines between the west area and the Somerville Vulnerable Fire Protection Service Districts. Pursuant to 153A-304.3, the board can by resolution relocate the boundary lines between the adjoining fire protection service districts. The intent of doing this is be beneficial to the property owners that this affects. It will help in their insurance ratings. It's only a few parcels that will be affected by this. A report has been made available to the public pursuant to the statute and maps for them to review it. We do believe that this would be in the best interest of the affected property owners to amend the West Area and Somerville Vulnerable Fire Protection Districts. We are here today to hold a public hearing and for the board to decide whether to adopt the resolution. If there are any questions regarding the specifics of this relocation, I do have Rodney Daniels here available, the fire marshal. I've noted that he has talked to affected property owners. He's also talked to the fire chiefs of these 2 fire districts. Thank you.
Now, do we have any questions of the board before we go into a public hearing? Seeing no movement, now we will open the public hearing in this matter. Does anyone who is listening, who has called in, have any comments about the proposed resolution? I'm sorry, between the relocate the boundary lines between adjoining fire protection service districts. Any comments? Hearing none, we close the public hearing. Do I have a motion?
So moved. I move that we agree and approve the moving of these boundary lines for the fire departments.
Do we have a second?
Have a second.
Have a second. Any discussion? Commissioner McCoy?
Yes.
Commissioner Johnson?
Yes.
Commissioner Sprinkle?
Yes.
Commissioner Miller?
Yes.
Commissioner Penny votes yes. It's 5-0. Now let me read the notes. It says immediately following here. Is that as much as we have to do?
That's all you have to
Okay, all right, thank you. Next on the agenda is Harnett County Finance Officer request approval of the Irwin Elementary School amended capital project ordinance.
Good evening, Mr. Chairman and Commissioners. This is Kimberly Honeycutt, the Finance Officer. Bringing back before you the Irwin Elementary School project ordinance. As we had discussed in the work session, the project ordinance for the construction of that school was actually approved on June the 3rd of 2019. at an estimated cost of $23.4 million. And during the past year with discussions, we have upped that amount. And so what we are doing is we are actually amending this ordinance to add an additional $4,018,277. We're putting that in contingency until we get a better breakout of what those actual costs in the various areas would be, to bring a total project of $27.5 million.
Thank you. Any questions for our finance officer? It's a quiet bunch tonight, so I guess that's good. Kimberly's giving me the thumbs up, so. So we will need a motion to change this, okay. Do we have a motion? Resolution of the commissioners on the,
Commissioner Sprinkle, I make a motion that we amend the capital project ordinance to $27,500,000.
do we have a second? I second it. I was waiting for my fellow commissioners. Now, is there any discussion? We have a second. Okay, we'll take a roll call. Commissioner Miller.
Yes.
Commissioner Sprinkle.
Yes.
Commissioner McCoy.
I have no choice but yes.
Commissioner Johnson.
Yes.
Commissioner Penny votes yes, so it's 5-0. Number 10 next, a resolution of the Board of Commissioners of the County of Harnett County providing the issuance of general obligation school bonds, Series 2020. That's, I guess we're gonna pay for this.
Yes, sir. That's why I'm still standing here.
Yes, sir.
All right, so the resolution that's before you tonight is you actually have to approve an amount not to exceed to fund this project. The county intends to sell GO bonds, and our anticipated sale date is June the 30th of 2020. And so we need you to approve a resolution that authorizes us to sell bonds. And we're currently projecting $27.5 million. That's the reason for the amended project ordinance. And right now, since we are in a premium environment, we anticipate a premium on those bonds. And I believe the last estimate from the GMP, the school system is looking at an approximated project cost of around $29 million. So if we issue $27.5 million with the anticipated premium that we are expecting right now in the market, there should be sufficient funds to cover this project.
And remind us, when we go to the LGC, it's pretty soon now, correct?
No, sir, we've already
We've already
been.
done
Oh, you did it on the 5th?
Yes,
When do we
sir.
do?
The LGC has to authorize us
Okay.
to put those bonds on the ballot, and the taxpayers approve them. And then we can issue those bonds. We already have the LGC's blessing.
Okay, thank you.
Question, Commissioner
Yes.
McCoy. This year upping it to the 29 million. Will any of that money come from our fund balance?
No, ma'am. Basically, what happens here is the $27.5 million is the number that we have used in our debt affordability model, where we have projected our sales tax revenues and all the restricted revenues and the county's local money that goes into paying this debt. We have projected all of that out that's set aside in your debt service fund. And we know that even with the issuance of $27.5 million in bonds, as well as the upcoming anticipated project, we're still looking at right now, based on current revenue projections, a slight tax increase, but that's in, I think, year 3 and 4. So as our revenue increases, we expect to be able to cover that deficit. But right now, if we issue 27.5 with the bond premium, we'll have enough to fund that project. But if there's any additional shortfalls, the county would have to cover it. But right now, based on the current market, I do not anticipate that being, that can change tomorrow, next week. But right now, currently, issuers in the market are experiencing a very nice premium.
Well, that's good, because the only reason I was asking is because they're predicting some terrible weather, hurricane weather this year, so I just want to make sure that we have enough in our fund balance to take care of citizens in this county.
Yes, ma'am.
Now I'm gonna ask the question the way I meant to ask it. When do we go to the bond market? That was my question, not the LGC. I said the wrong.
Oh, I'm sorry, June 30th.
June 30th. I knew that was coming up pretty quick.
Yes,
Okay.
sir.
Any other questions for Ms. Honeycutt? Now, do we need a motion on the resolution? We do. Everybody shaking their head yes. Okay, do we have a motion for the resolution to issue of the general obligation school bonds?
Commissioner McCoy make the motion.
Do we have a second?
Second.
Before we go any further, I would remind whoever's calling in to put your phone on mute because we hear you in here in the meeting room, so that would be appreciative if the phone was on mute. Thank you. Okay, we have a motion and a second. Do we have any discussion? Seeing no movement, we're ready to vote. Commissioner Miller,
Yes.
Commissioner Springle,
Yes.
Commissioner McCoy,
Yes.
Commissioner Johnson,
Yes.
Commissioner Penny votes yes, so it's 5-0. Next up, consider approval of the Harnett County 2020-21 budget ordinance and budget. Ms. Stewart.
Well, before we go into that, I just wanted to mention that we did get our bond ratings back from Moody's and Standard & Poor's today. So Moody's, we got the AA2, and the S&P was AA negative. So we didn't change our rating, but we didn't go down. So we felt really pleased that we got the ratings back, and thanks to finance and everybody that worked on that, all of us in administration, we worked hard to get that, to go through that process. It's a very intense process of trying to tell your story to people that know nothing about Harnett County, or nothing about North Carolina, most of them. So it was a good process, and we're pleased that it's over. We'll have to turn around and do it again soon for Northwest Harnett, but for right now, we've got Irwin over. So I'm before you tonight to talk about the budget ordinance that I presented to you tonight. So as required by the Budget and Fiscal Control Act, the Board of Commissioners must adopt a budget ordinance to enact the fiscal year 2020-2021 budget. And the following changes, I want to just go over the changes that we've made since I gave you the recommended budget back in May, because we have several work sessions and some things changed. So the first thing that changed was directed by you. We increased, in the general fund, we increased our revenue by taking out a little bit more fund balance of $3,500 to cover the nonprofit appropriation that y'all approved at the last meeting, at one of the meetings, $3,500. So the difference was the budget went up by $3,500. We had to correct some errors, and there were some things we had left out of the budget before. Again, we had to increase our fund balance appropriation again by $5,200. We had failed to budget correctly for the fire retirement in the EMS department, and we had to reduce the rescue transport budget to remove vehicle maintenance. We've changed the way we do vehicle maintenance. So these are some minor changes, but I just want y'all to know about them. So there won't be anything different in there for you. In the special districts, we had to increase Benhaven Fire District and increase Somerville Fire District. We had calculated those amounts incorrectly, so we had to correct those. And then the solid waste reserve, which is a new fund. We've never had, go ahead.
On the fire districts, what are you correcting there?
We had put an incorrect amount. So for the Benhaven Fire District budget, the motor vehicle tax, we had to increase it by $9,349.
Okay, so we didn't change the...
No.
Okay.
No,
all right.
we just had to change some of the budgeted amounts that were in the details.
Okay, all right.
We recently added a solid waste capital reserve. We've not had that in the past, if you'll recall. So we did budget the transfer from the solid waste operating budget over to a solid waste capital reserve in the amount of $887,185. So that's going to keep their capital projects moving instead of when they haven't had money, they haven't been able to do them. So this will help us get more in line with the rest of the CIP. And then the solid waste post-closure fund, we also had to transfer money from the solid waste operating budget over to the solid waste post-closure fund in the amount of $237,350, because we're mandated to do that whenever we close a sale. So in addition, there were a few more changes that we changed the wording from the way we had done the budget ordinance last year. So just to give you a few highlights, under expenditures and revenues, under sections 1 and 2, under section 1, we broke out the expenditures from the revenues this time. we gave you greater detail on the revenues than we've given you in the past. We've also listed all funds and departments in alphabetical order to help you when you're looking it up to see specific departments. And we changed the wording of section 1 to make it more clear that the appropriations apply to all funds, not just the general fund. So we're having standard verbiage for the enterprise funds as well as the general fund. Let's see. The tax levy under section 4, we changed a little bit of the wording for the Aversboro School District and the fire districts. We slightly revised that wording. It's nothing that changes any dollar amounts. It's just so that to make it more clear to somebody reading it that has not read it before. We also clarified some language under the rate and fee schedule. That was section 8. Under section 10, we did change the wording under the personnel and compensation to reflect the 1.5% performance pay plan increase. And under the section 11, the salary and grade table, we did make it clear that you are adopting our salary grade table as part of the budget ordinance. We've kind of attached it every other year, but we haven't really spelled out that you're actually approving it. So we changed that wording. And then under section 12, I talked about this a little bit at the work session, but anytime we're changing the wording about reductions in state and federal funding. So currently the ordinance does not allow the county to absorb a reduction from state or federal funds, and it requires departments to adjust their budgets to show any revenue loss. But the new wording proposes that the board can make exceptions if you desire to. Because we ran into a situation recently with the health department where one of their funding sources was going to stop some of the funding for the nutrition program, and we felt like y'all need to be able to, we were too stringent on saying you can't do it at all. So there's going to be certain situations where you may want to make an exception. So we're giving y'all an out in that section. And then under section 13, we changed a little bit about the way we mentioned the Fiscal Control Act, just so that it would match up with the statute. So a lot of what we're doing is we're just changing it to clear it up to make the language all consistent. And then under section 14, the capital improvement plan, we reworded it to reference the plan, and we're not going to include them as an attachment since the plan, you already adopted the plan back in the fall. So that's why we didn't include that in here. So that's just some of the changes, but it was very minor dollar amounts. The totals didn't change. The general fund is still at $127,414,558. So $127,414,558. Solid waste budget $6,554,692, and Harnett Regional Water $36,907,784.
And what are we sitting as our general fund?
Fund balance, we don't have the 19, well, we just got the 19 numbers. We're sitting at about 24%. I don't have the exact number, but about 20. We've been hovering around the 25, but we're down to a little bit about 24%.
So you're down at $8,700 is all you're taking out of the general fund with this
Right.
last exception, because the 800,000 came out of solid waste fund. correct?
Right.
Okay.
Yeah, so it's only 8,700.
Okay.
And then all we're asking for now is for you to adopt the budget ordinance tonight.
Okay, we've heard the presentation. Do we have a motion to accept our budget ordinance?
Commissioner Springler, I make a motion that we approve the 2021 budget.
Do we have a second?
Second, Commissioner
second.
McCoy.
Do we have any discussion? All right, we'll take a roll call. Commissioner Miller,
Yes.
Commissioner Sprinkle,
Yes.
Commissioner McCoy,
Yes.
Commissioner Johnson,
Yes.
Commissioner Penny votes yes. It's 5-0. 5-0. We approve the upcoming fiscal year budget. Thank you. Next on our agenda.
Good
is-
job.
Appreciate everybody.
You did a good job, everybody.
It's teamwork.
All right, Mr. Haney, we will hear from you on administration's request for following changes in the Harnett County Personnel Ordinance.
All right, good evening. These are the proposed changes to the personnel ordinance that were discussed during the work session last Tuesday. I'll go over what's included in the agenda request, and then everything else is included in the package. The first update is to Article 3, the pay plan, and the main changes are updating the performance pay plan, including adding eligible part-time employees into the plan, moving the effective date of earned performance increases to the start of the pay period immediately following an employee's anniversary date, updating eligibility requirements, and allowing the county manager to address situations where employees who are left in the 3-5 plan after July 1 of 2017 would have benefited more from inclusion in the performance pay plan. And again, that is pending funding availability. The next change is to Article 4, Section 8, probationary period of employment. This updates this section to allow promoted employees to use leave during their probationary period. Next, Article 5, Section 12, performance evaluations. This updates that section to make clear the guidelines and expectations for the timely completion of evaluations and the submittal of any resulting personnel actions. And finally, in Article 6, Section 3, vacation leave, this updates this section to allow promoted employees again to use leave during their probationary period. And if there are no questions, we would request that this be adopted to be effective July 1 of 2020. So, any questions?
Seeing no movement, I assume we have no questions. So do we have a motion to accept the Harnett County Personnel Ordinance changes?
Mr. Chairman, I move that we accept the new Harnett County employment ordinance.
Do we have a second?
I'll second that.
We have a second by Commissioner Johnson. Any more discussion? Another roll call. Commissioner Miller, I assume you vote yes, you made the motion. Is
Yes.
that correct? Commissioner Sprinkle?
Yes.
Commissioner McCoy?
Yes.
Commissioner Johnson?
Yes.
Commissioner Penny votes yes, it's 5-0.
Thank you.
Moving right along. Next, we're going to get a COVID-19 update. And the correct answer is we're all recovered now.
Good afternoon. Wanted to just give you a couple of numbers. Last week, estimated about 552 tests were done for Harnett County residents throughout the county and surrounding facilities. Overall, we're probably looking at about a little over 2,400 tests that have been done county residents. That's about 1.7% population, and about 1.7 of those test positive. Our case load now is well, this afternoon we're at 412 confirmed cases. We have had 30 deaths. I think last weekend or the weekend before was the last time we actually had a death, so we've been fortunate. That graph there just shows from beginning in March kind of what our caseload has done. You know, we talk about that one first bump we had with a long-term care facility, but since then we have steadily risen with our case counts. And then these are our cases by week. If you look there toward the right-hand column there, we had started trending down, but since the end of May, we have been trending back up with our case counts. Go to the next. Now you're going the wrong way. Yeah. Okay, these are our cases by age. Again, most of the cases from 25 to 65 population. Since the end of May, we have seen a larger increase in the 25 to 50-year-old age range.
What do you think attributes to that, John? Any idea what attributes to that?
I think just society opening back up and, you know, people getting out and about, and, you know, we saw a lot over Memorial Day where, you know, people were just not social distancing and that type of thing, and that's what I think we're seeing in that age population.
But as we test more, we're gonna have more cases.
True.
Okay, but everybody throws the cases out there. Impress me with how many in hospital? How many of the cases are just a cold?
I think overall we've had around 50-55 that have had to be hospitalized. I think right now there are probably 6 or 7
6 or
that
7
are
still?
hospitalized. And
So-
that number had actually been trending down to where early in the month we were down, I think, 2 that were in the hospital. It has trended back up in the last 10 days.
But most cases that are out today or common colds, feeling bad?
When again, most of the ones, unless they're hospitalized, we're still seeing mild symptoms in
Right.
cases.
Okay.
What age group are in the hospital now?
I think we have from, let me say, from about 30 on up. Initially, it was the elderly,
Yeah.
senior citizens that we were seeing. We have seen some younger patients being hospitalized. Something we've added, I've added some more demographics about race and ethnicity. 134 of the cases white, 98 black, 167 are Hispanic, 13 are classified as other. Then by ethnicity, really 167 Hispanic and 232 non-Hispanic, and again 13 are other. And then by gender, 47% male, 53% female. And then by death, again, most of the deaths that we have had in the county have been senior citizens, 65 and over. We have had one in the 25 to 49, and I think one or two in the 50 to 64. And then death by gender, 57% male and 43% female. So that's kind of an overview of where we are. Give you a little bit of information about the tests that have been done. Does anybody have?
I have a question. So when you get the number of tests, if a person tests positive and then they go through the period and they get well, they have to be tested again to show that they're not positive anymore to go back to work. Does that count as an additional test?
No, and really there's you have to be, from the date of onset, you can go 10 days with 3 days asymptomatic, and you can classify as being recovered. There are some situations where individuals are going back and being retested. If you're retested, you have to have 2 negatives within have to be a 24-hour separation between the tests, and that would classify you as being recovered. Now,
So does that count as 3 tests or 1 test?
That counts as, well, you got your positive test where you were positive, and then you have to have the 2 24 hours apart, 2 negative tests.
Okay, so when you start looking at tests, does that count as on the total test?
It does.
Okay. The other question I have is, I noticed that I was talking to someone over the weekend that one of the issues they're running into is that if a person's in the hospital and they went in the hospital with symptoms of COVID-19, but they die for some other reason, it's a benefit to the hospital for them to die as a COVID-19 as opposed to whatever they actually died from. Is that true or not?
I don't know.
Because I was talking to somebody that worked at a hospital in Raleigh, and that's what they said that they were running into. The hospital gets paid money because that person died because of the COVID-19, and they wouldn't have got any additional revenue had they not. That's some other reason, for some other reason. It doesn't make any sense to incentivize the hospitals to create more deaths because of the COVID-19 as opposed to people going to die anyway from whatever the reason that would be.
Most of the deaths that I'm aware of in the county that have been classified with that went in as a positive.
Okay.
They would admit it as a positive.
If that's happening, that kind of fuzzy the numbers though,
Oh, yeah.
a lot.
Yeah.
So that's an interesting subject.
Oh, yeah.
Yeah. The ones I'm aware of were admitted as positive COVID
Okay.
cases. Now, did they have did they have underlying situations? Everyone that I'm aware of did.
Okay.
John, what impact is it having on our 2 hospitals in the county as far as other illnesses not going to the hospital now? So is it having an impact because of the COVID scares that people are not going?
I actually think I talked to the hospitals on Friday. I didn't have a chance to call him today. I usually call them on Monday just to see how the testing and the ED visits and that kind of thing have done. Their actual ED visits, I think, have started to increase. They're starting to do outpatient surgeries. This month, when I've talked to them, they're doing surprisingly doing well. I don't think they're getting inundated with with these or in the testing through the ED. They're trying to refer people that contact them to their primary care practices and enroll them as a primary care patient. And we're still encouraging folks, if you feel like you need to be tested, to go to your PCP and be evaluated and tested.
Okay, good, thanks.
I think their PPE or they're well holding up there. I think a long-term care facilities.
We're doing, as we speak, we're today actually back here in the warehouse. Our EM team has gone down to Lumberton last week and picked up a bunch of state-issued PPE for the long-term care facilities, and they've been issuing that out since last Friday. And we've got a couple more homes to get that to, but that was a pretty large push. That was a 30-day supply. They received last week and this week. They should also receive deliveries at their facilities from FEMA also. So they're sitting pretty good with that right now. We haven't had any big requests for it, but we've been able to fill everything we could that's out there right now. And our 911 volume of our normal calls, with John's talking with the hospital picking up, our headaches, our stomach aches, those things are starting to pick back up again, where people weren't calling for those very reasons. So we're moving a lot of folks to the ED too.
We're starting to see infants come in for baby shots, immunizations, and their child physicals, and starting to even get some school physicals and that type of thing.
Great.
Great. Y'all done a great job.
Yeah, thank you.
Thank y'all for y'all's support.
Next up, we have county manager's report.
Well, I want to follow up with what they were saying too. We've been talking about trying to decide when to open up county government to the public again. So I was kind of wanting to get y'all's feedback based on everything you've heard, what your thoughts are. We had said maybe July 6th, and I didn't know if y'all want to do it then or later, and that we are proposing that the library would open and the municipal libraries would open Monday, June 22nd. They would do a lot. They've already got everything prepared. They would do the same thing stores have to do. But they're proposing to go ahead and open. They've had a lot of requests, people that are out of work that need to get on the computers. They've had a lot of people wanting to come in and get books and that kind of thing. So they feel like they're ready to open now. So the library would be our first, besides the courthouse that already opened last week. This will be our second opening. So we just kind of want to get y'all's thoughts and just see if you wanted to go ahead and set a date to open or wait till our next work session and talk about it again on June 30th.
Well, I do, open up, starting to open up facilities. So I don't know how much sense that makes. If you're gonna open up the library.
Well, a lot of offices like this one, we don't really have a lot of public that comes in, so we were kind of letting the departments that are frontward facing, like the health department, like the library, like the courthouse, they have to be open in order to conduct business. But the rest of us are, it seems to me, everybody I've talked to, all the department heads, everybody's been able to be serviced, not open. And that was why we were just trying to keep stopping that spread, not letting other people come into our buildings. It was the main reason for keeping most of them closed to the public. And just having the ones open that needed to open to conduct their business. So,
Places like social services, I think what they're doing
limited,
things.
by appointment, right.
They would need to be open the way they've changed their operating procedure.
Right, and that's what I was going to say. A lot of departments have adapted to this way of working, and so it's not as big an impact as you would think. And if we do need to meet with people, like we go outside, and I've met with a couple people outside, or they'll bring documents to us and drop off. So I mean, we kind of feel good, really not like totally opening up, and just keeping it the way it is. But then we would need to discuss at your board meetings. Is this working? Is it not? I mean, we haven't gotten any complaints from the public as far as not being able to come. I mean, they do call and say, are you open to the public? And we just say not yet, and people call in, we tell them they can call in, they can send any statements or questions to the clerk, and we haven't really had any problems. So we would feel better if we just kind of waited and just talk about it again, but go ahead and let the library just see how that goes. And John's got some thermometers, the gun type thermometers that they can do checks with if we need to. They're doing that at the courthouse. And you're not doing it at the health department, right?
We
Temperature checks.
We screen patients when they walk in, and if they answer yes to certain questions, you're gonna get checked.
And
But, Mr. Chairman, if I'm in order, then I think that's something that we can discuss on the 30th.
Okay, we'll put it on the work session agenda.
I think it's better to discuss it than just make a.
But let the library go ahead and open.
Oh, no,
to
I'm
see how
not
they-
saying anything
Yeah, I
like
think that'd be
that.
great.
I'm talking about open up other facilities.
The department heads that have more public access than others, do we have the plexiglass, the sanitizer?
We have everything.
Have we got everything in place so we can do this?
We have done everything that we can do to the build, that we know of in the pre-planning. Now, of course, when we open, we won't know if it's good enough or not, but we've done all the facilities has done an outstanding job getting all the plexiglass. They have the courthouse looking great if you haven't been there. All the courtrooms have it. Everybody's very divided. They did a great job. So, yeah, we're ready. All the departments are ready. All the libraries are ready. We assisted the town libraries with their, getting ready for it, reopening.
I went to my first doctor's appointment in Raleigh since this started Friday, and I was amazed how efficient it worked between the protocol to get you in, take your temperature instantly. Well, first thing they do is make you sanitize yourself. If you don't have a face mask, they put one on you. But I was actually impressed. It seemed to be a lot more efficient under COVID-19 protocols than going and sitting in a wait room waiting to see your doctor prior. So if anything, I was impressed by how efficient. So I was hoping that we've got protocols in place in the county, so when we do open up, it will move along.
We do.
Thank you.
We do.
Paul, you talking about opening up the library, what date?
June 22nd, so next Monday.
Is that 50%?
Yes, they'll have to abide by the guidelines, the 50%. And they've got, I think they've got the floor markings, and they've got all that stuff in place too. So where, like if there's gonna be people lined up, they've got the 6-foot markings on the floors, like we've done in here. Did you want to say anything
I
about
have another question. On the courthouse, are they having regular court or?
They-
Stagnant?
They haven't had a really busy court date yet. We've been speaking with them every week to see how it's going, and so far it's going well, and they haven't really, if they've turned people away, they've not had any problems with that. So as far as I know, everything's going well with them. I did not talk to them today, but I have talked to her several times over the course of the opening, and it's going well.
Yeah, just to talk a little bit more about the libraries, the plan of Angela McCauley and her staff have worked very hard to get the library ready, as have county facilities, and as Paula mentioned, they've coordinated and engaged with the municipal libraries to make sure everybody's doing the same thing and consistent so that the public throughout the county has a consistent experience. They are looking at opening next Monday, the 22nd. However, Angela will have a call tomorrow with the municipal library directors to confirm that everybody's on board with that plan. If not, that may be pushed back to the 29th, but at this point we believe it will happen on the 22nd. And again, they've got some very plenty of precautions in place in terms of letting people in. The computer use will be limited. Every other computer will be available. They've actually got, they'll be changing in and out keyboards and mice so that each person that uses a computer will have a new one that has been sanitized. So they've worked really hard to get that in place.
Good deal.
I wanted Brian to mention too, I appointed him to be the COVID-19, the CARES Act funding. We had to have a plan to the state by today, and I just wanted Brian to give you an update that he did submit it this morning, so.
Yeah, just kind of a continued update, not much to it, but we did submit the county's plan today for the amount of $2,462,374. We will continue to monitor that plan and update it as things change in terms of approved expenses. We are working with the municipalities currently to look at what they have requested and to be able to provide them guidance on what is reimbursable and what is not. So we'll just keep monitoring that and submitting the reports as required.
Do we know where the money's going?
The money is going primarily to it has to be spent on COVID-19 related expenses. So a good portion of it will be to help the health department with what they have to do in terms of testing, tracing, that sort of thing, operations. A good portion of it has gone to our public safety departments, emergency services, the sheriff's office towards, they're the front line obviously of engaging with citizens to try to protect them. As well as to prepare county facilities to be open to the public, and similarly for similar municipal expenses that they've requested, because this funding came from the federal government through the state to the counties, and we are also the entity that is responsible for passing that on to the municipalities for those related expenses.
Thank you.
Yes, ma'am.
And the only other thing I have is your invitations and dates of interest. The only thing on here that is new from last week, the Board of Education voted to have their groundbreaking for Irwin Elementary School on Tuesday, July 14th at 9 a.m., which is the same time as we have a work session. So I didn't know if y'all want to consider at some point, if you want to attend that groundbreaking, if you want to come have your work session later. I'm not sure, or reschedule it. Just kind of wanted to let you know about that. And that's all I have.
Any new business? I see our attorney with that magic piece of paper in his hand, so I guess we got a need for a closed session.
We do not.
We do not. He was okay.
Playing the game.
Do we have a motion to adjourn?
So moved, Mr. Chairman.
Second. Okay. I'm not going to take a roll call. We're adjourned.
Just see Dwight playing me.